Hi, everybody. I'm Dr. Lizbeth Roy. Thank you so much for joining me. It's 7 o'clock, so I promise to start promptly, and we'll go ahead and get through this presentation. A couple of things. First of all, I will make the slides available to anyone who is interested. Happy to do that. There's an email address at the end, so you can send me an email. Also, if you have any questions, I'm going to keep everybody muted so that we don't have any interference. Please feel free to just type your question in the chat box, and I'll look at it periodically and try to answer those questions, okay? I am certainly available for any questions after the webinar. You can send me an email. I'll give it to you right now. It's Dr. Roy, D-R-R-O-Y, at doctorsstudio.com, and that's all spelled out, doctorsstudio.com. There's also an email address at the end of the webinar, so you're welcome to contact me either way, and I will be sure to answer any questions that you might have. So let's just go ahead and get going. This is a new platform for me, so I'm hoping that everybody can hear me, and I'm hoping that you can see the presentation. Unfortunately, you'll have to be bothered by the slides here on the left of the screen, but hopefully the image is large enough. So let's just go ahead and get going. This presentation is about regenerating your practice revenue with the regenerative technology platelet-rich plasma. And some of you may already be using platelet-rich plasma. So I'll just tell you a little bit about me. Again, my name is Lizbeth Roy. I practice functional and regenerative medicine, and I've done that for the last 12 years. I am the founder and medical director of my practice, which is called Doctor Studio. And I also am a co-founder of Studio PRP Network. And Studio PRP is a training, research, marketing company. And we are really excited about platelet-rich plasma and what platelet-rich plasma has added to my practice and the hundreds of physicians that I've trained over the years. I speak nationally. I have written a book that I'll show you a little bit about, and I've been teaching practitioners for about 6 years. So my personal journey with platelet-rich plasma started in 2010. I was at an A4M conference in Las Vegas, and I heard a speaker talk about platelet-rich plasma and what was happening with aesthetics and platelet-rich plasma. So that's what I brought home. I actually went and purchased my centrifuge, and there was no training at that particular time. I had to take it home and figure it out, but it was relatively easy because I'd already been doing aesthetics for many years. So to use platelet-rich plasma made a lot of sense to me. And I really embraced it. I saw what platelet-rich plasma was adding to my aesthetic practice, and it was really exciting. Patients that I've been taking care of for many years with Botox and filler and all the typical aesthetic technologies were loving what PRP did from a regenerative perspective or rejuvenation of the skin. So when I saw what would actually happen and I saw that cellular change, I thought, you know, this could certainly work for sexual medicine and urinary incontinence. So I got some training to do those procedures, and in 2011, I introduced those to my patients. Very shortly thereafter, I started injecting PRP to regenerate hair and also for musculoskeletal pain and joint pain and dysfunction. So I've been using it in my practice for quite a while, and I have to tell you, it really is truly amazing when you use the right PRP for the right application. 2011, I started training physicians, nurse practitioners, PAs. 2014, I thought, well, you know what? I really want to embrace this whole regenerative process. And so I went through the stem cell fellowship through the A4M, also got some additional stem cell training through RegeneStem. And I haven't actually incorporated stem cells into my practice. I haven't needed to, and I've been a little bit leery about it. I'm not convinced that it adds a great deal to the effectiveness of platelet-rich plasma, and we'll talk a little bit about the science and why I feel that way. And certainly willing to talk to anyone about stem cells and what I know at any time in the future. So it's not that I don't respect stem cells. It's just that I haven't found the need to really embrace them. In 2014, I co-published the first PR paper about platelet-rich plasma and how it pertained to female sexual function. In 2015, as I mentioned, I co-founded Studio PRP Network to support physicians. I found that after training many doctors, they would take this technology home and not really know how to implement. And as we know, all of us with FPC, it's that implementation, it's that follow through, it's the staff training, it's all of those little nitty gritty details that will make or break us. So we can take a perfectly good technology and learn how to apply it from a clinical perspective, but then just be a total flop at our practices. So I co-founded Studio PRP with Jill Swartz, and we put together some marketing material and other ways to help you and your staff implement so that you can be successful. 2015, I authored a book here on the right side, Regenerating Sexual Potential. And this is a very important book to me. It's really a guidebook. I wrote it with the patient and the practitioner in mind. Men and women don't understand all of the ways in which we can help them repair sexual function. And sexual function is just so important to us as human beings. It's important to our self-esteem, our relationship with ourselves, our intimate relationship. And so I felt that it was necessary to help people understand that there's lots of help available. And platelet-rich plasma certainly lends a lot to that whole end. And urinary continence with women, it goes on, and I'll continue to talk about that as we go forward. In 2016, I was a participant in a small study for erectile dysfunction using platelet-rich plasma. My colleague, Dr. Joseph Bano, who's a very, very well-respected urologist, presented the poster at the SMSNA, which is a large sexual medicine urology conference in Phoenix, Arizona, 2016. So that was pretty exciting. And so there's a lot happening in the world of platelet-rich plasma. In fact, we're expecting PRP to increase from $160 million, which we saw in 2015, to $450 million by the year 2024. So it's certainly growing exponentially. And there's lots of reasons for that. We're finding new ways to use platelet-rich plasma every day. It's incredibly effective. I'll share some anecdotal stories with you, some of my own personal experience as I present this to you. But if you consider the aging community, myself being one of them, and the wellness industry that we're all in and enjoying and realizing that people want and are embracing, this is just a no-brainer. The wellness industry is going to be a $1 trillion industry in the next 10 years. So PRP and regenerative functional medicine and all these regenerative techniques, they really go hand in hand, and people are looking for these options. So the short history of PRP, a cardiologist first introduced the use of platelet-rich plasma in an open heart surgery in 1987. Shortly thereafter, PRP was adopted for use in pain medicine, wound care, dentistry, and veterinary medicine. So in fact, the dentists have embraced this technology 20 plus years ago. So they're way ahead of us. Veterinarians used it as well. They were next. And then we're moving this thing forward. And what this cardiologist found was, he used platelet-rich plasma to help with fighting infection. But not only did it fight infection, but it also decreased the pain medication that was necessary and facilitated healing. So that was really breakthrough. I have a vascular surgeon friend of mine that used platelet-rich plasma to close for the last 20 years. And he says that since he started using platelet-rich plasma in that way, it was very easy to do. He had zero wound dehiscence. He had zero complications, wound-type healing complications post-surgery. That's a big, big deal. So we really are regenerating tissue and facilitating healing. So PRP's gained popularity as a safe alternative to surgery. There's very few contraindications. And in fact, it truly is a safe and natural alternative to surgery. You can repair small tendon tears. There's a lot that you can do with PRP. And it's been proven in countless clinical trials to be an effective medical procedure, where healing and regeneration are the goals. And so, we see this again in wound healing. We see this in the orthopedic literature. So people really have been very interested, and their interest has peaked as some of these professional athletes and celebrities have started to talk about this. You know, Woods has had platelet-rich plasma. Several of the basketball players have had platelet-rich plasma. We know that Kim Kardashian had the vampire facial, so she really caused quite a boost in my business by going on air and showing what she does to regenerate her skin. And so a lot of press about platelet-rich plasma, a lot of excitement about platelet-rich plasma at the clinical level as well, because again, it's effective. So, you know, you think about urologists. Urologists are really very traditional, and they're very mainstream, and you know, they are very conservative. I'm going to be nice. They're very conservative, and they're not easy to change. They don't embrace change very quickly. And Viagra was the most exciting thing to happen to sexual medicine, male sexual medicine, for a long time. Now there's platelet-rich plasma, and we have very mainstream urologists using platelet-rich plasma successfully. In fact, I just heard from the physician that runs Weill Cornell. He has just last week the approval by the IRB for and the FDA actually to study platelet-rich plasma for male and female sexual dysfunction. Now that is a huge deal that we have Weill Cornell now, as a result of our pioneering this in this realm. As a result of our effort, we now have Weill Cornell doing what we need to be done, to do a formal study that everybody approves of, to look at the actual efficacy. I can tell you that this is effective, but again, we need a large scale study, and these things are starting to come about. Gynecologists are embracing this. A lot of us generalists and family and physicians and internists are using platelet-rich plasma for women with sexual dysfunction, changes like vaginal dryness, decrease in sensitivity. Certainly the orthopedics have embraced this. And strangely enough, there are still some orthopedic surgeons who haven't. And it kills me. I'm not really sure what they're waiting for, except when you look at the literature, there's a little bit of controversy, and we'll talk about why that is. And we know now why that is. Anytime you have a new technology like this or a new modality, it goes through its growing pains. And part of that growing pain is just figuring out how to use it, you know, and what's the best patient, and what's the best kind of platelet-rich plasma. You know, how do we know? We look at the basic science, but then we have to apply it clinically. So it's gone through a lot of those changes, and you know, as I showed you in a previous slide, it's really going to take the medical world by storm. We're at the front of this very large wave. We're using it in hair restoration, not only in conjunction with hair restoration surgery, where we actually float the FUEs in platelet-rich plasma to improve the survival and the quality of that follicle, but also we're using it, just injecting it into the scalp using a relatively easy technique to stimulate the stem cells at the follicle level. So we're actually getting a re-stimulation of hair growth. So the quality of hair improves and growth improves. Certainly there has to be a viable follicle in there, but a lot of times the follicle's just dormant. You have to wake it up. We've been using it in the aesthetic arena. Again, plastic surgeons are using it in conjunction with their surgery. They're getting a much better result, a much faster healing time, fewer complications, but even the skin quality changes. I've been injecting it for aesthetics. I use it with my microneedling device. I use it in conjunction with my lasers. I use it with PDO threads. I use it for all kinds of aesthetic purposes, and with all of my aesthetic technology. So I actually use platelet-rich plasma with pretty much everything. Dermatologists are using PRP to help solve acne. Even active acne lesions will be resolved with platelet-rich plasma. And as we know, as functional physicians, then we go ahead and we correct the underlying triggers. And that's what makes us really the best users of platelet-rich plasma, is our functional medicine expertise, because we're using PRP stimulate some regeneration, but we're actually improving the health of the body so that those outcomes are even better than, you know, what a traditional dermatologist would get. Traditional dermatologists might solve that acne problem, but if that trigger continues, then the acne is just going to come back. So we have really the leg up. Ophthalmologists are using platelet-rich plasma as well. I'm doing a little, a very, very small look at dry eyes with platelet-rich plasma. So there are actually some companies that are trying to make a dehydrated PRP that could be reconstituted to use as a drop for dry eye. It works incredibly well as a drop. I've actually infiltrated the eyelid to see if we could re-stimulate the glands. And so we have a scan pre-injection that shows some of the glands are dormant, and then I'm waiting for a follow-up scan. My patient has much better lubrication, and she has much less discomfort, but I want to see if we've actually re-stimulated some glands. I think we can. What we've been able to do with this PRP is pretty awesome, and it's a lot of fun to use PRP because you don't have to worry about hurting anybody. And that's why it's so exciting to me, because you can be on that cutting edge and you can be in discovery, which is what we've been doing for the last six or 7 years, but you don't have to hurt. You don't have to worry about hurting anybody. All right, let's move on. So when we think about the biological process, when we inject platelet-rich plasma or when there's any sort of regeneration, any wound healing, what you get is mesenchymal cell migration to the area. You get the platelets actually break open. They spill growth factors. Growth factors start to stimulate fibroblastic activity. If you use the right platelet-rich plasma, you attract mesenchymal stem cells to the area. You get a migration, proliferation, and then a differentiation. Voila, that's your regeneration. So that's the basic process. You know, and there's no mystery about this. PRP, I've heard some doctors say, well, I don't believe in PRP. I don't believe. It's not a religion. This is the way the body works to regenerate and restore function. And so what we're doing is we're just concentrating it and directing it. Patients love that thought. They get it. They really understand. We know what growth factors we're dealing with, at least some growth factors. I'm sure there's a lot we don't know, but we know the growth factors. If you're using a professional platelet-rich plasma, you even know what the growth factor concentrations are. And so we're really growing up here. And when you look at these growth factors, and you see that it's, you know, the TGF-beta stimulates undifferentiated mesenchymal stem cell proliferation, regulates endothelial mitogenesis and fibroblast mitogenesis and osteoblastic mitogenesis. And so, you know, we know what's happening here. So when you think about sexual function, for instance, if you're able to restore the endothelial function, then you're certainly going to improve erectile function. If you're able to stimulate collagen, then you're certainly going to see the effects from an aesthetic perspective or a wound healing perspective. So you get it. You know, you really get it. If you come down here, you can see, again, the endothelial chemotaxis and an angiogenesis. We get a neuroangiogenesis, so we're able to restore sensitivity in addition to blood flow. Okay, so when you look at the basic science and you say, you know, if I dump some of this stuff in the area of interest, well, then why wouldn't it do what we know it does? All right, so that's when it gets fun. And then when we really tease out the details, we then find that different concentrations of platelets in, or even the biologic proteins in our platelet-rich plasma will give us either enhanced mitogenic activity with mesenchymal stem cells, or there's even diminished returns if we're too concentrated. So you can see that this was a study done that looks at the relationship of platelet concentration and mesenchymal cell migration and proliferation. So we're at sort of 5 times baseline or 10 times baseline. I have a much longer basic science PRP basic science presentation that talks about why our 4 to 6 times baseline really is our magic when we're looking at angiogenesis and stem cell migration. So you have to look at all of the details, and they stack up to where 4 to 6 times baseline, or 100,000, a million rather, I'm sorry, a million platelets per microliter to 1.5 million platelets per microliter is really the sweet spot. So that's beyond the scope of this discussion, but I want to point out to you here that there is basic science, and that basic science really points us in the direction of not only what can we do with this stuff, and use your imagination and try it, you'll be surprised what happens, but also what's the right kind of platelet-rich plasma. And there is a right kind of platelet-rich plasma, and what we'll see in the next 5 years is there might even be a right platelet-rich plasma for each type of indication. So for instance, if I'm doing surgery, I want a PRP that is 4 to 6 times baseline, but I'm going to want some granulocytes in there because that's going to act as an antibacterial helper, if you will. And so that is something I'm interested in. But that's going to cause an inflammation, which in that particular case is good. If I'm trying to help a woman restore sexual function, or I'm trying to regrow hair, I don't want those granulocytes because I don't want that inflammation. I want the monocytes, which is going to give us a long-term anti-inflammatory effect. So you get the idea that there's really a little bit more to it than just drawing some blood and putting it in a centrifuge and spinning it. You got to really know what you're doing here. It's not difficult if you just understand some of the details. And this is my niche. This is what I do. I'm probably one of the I guess I'd call myself a leader in this. You know, you hate to think of yourself in that way, but I go to these international conferences and I speak about this stuff. And even doctors that have been using PRP for many years, they're surprised by the level of detail that I'm presenting. And I'm surprised that they don't know it because it's actually in the basic science. But you and I know we get caught up in our day-to-day, and there's so much happening that it's hard to really be an expert in everything. So this is my niche, and this is what I do. So the equipment that I use currently, and I've used them all, I have purchased and sold back. I sell mine on eBay when I'm finished with them, my little trick there. I've purchased over 8 different PRP systems, and I do that because I want the best patient results. When you get good patient efficacy, it's good for business. You know, it's not only good ethically to give the patient the best that you have, but it's good for business. I built my business on word of mouth because people know that that this is what I do, and I'm constantly trying to get the best results. So the system that I'm currently using, and I believe I'll be using for a long, long time, is the M-Site Pure PRP kits. And I love this system because it's so flexible. You know, I can spin whatever PRP I want with this system. What you'll find if you have a system currently, you'll find that most of them, there's a fixed PRP milieu, I guess, if you will. You can dial concentration on some of them, but you can't necessarily dial granulocytes or monocytes. You can't be really flexible. Well, with this system, I can be very, very flexible. I can have red blood cells in my sample if I want, but I don't have to. And in fact, for all of the things that I do in my practice, I don't want red blood cells in there. What's beautiful also about this system is that it's very simple. There are 2 types of cylinders that come in the kit. Everything in the kit comes with everything that you need to make PRP. That's the other thing. There's anticoagulant. Even your blood draw kit is in there. You get two of these different cylinders. The first cylinder is a 1.5 minute spin. And what we're doing here is we are driving all the red blood cells and the granulocytes down to the bottom. And we're creating a platelet suspension in this particular spin protocol. Then I take that platelet suspension, I put it in the second cylinder, and I spin it again, and that drives all my platelets and biologic proteins as well as my monocytes to the bottom, at which time I then take off whatever platelet poor plasma I don't want, and I resuspend the platelets in 10 cc's, for instance. So I turn 60 cc's of whole blood into 7 to or 5 to 10. 10 is my typical go-to cc's of platelet-rich plasma. And so I'm at my 4 to 6 times baseline sweet spot. And so again, that's my protocol A. My protocol A allows me to process my PRP without granulocytes, with a very high concentration of monocytes, and with very little, if any, red blood cells. But if I were doing surgery, I would want to spin protocol B, where I can leave the granulocytes in there, still get a nice yield of monocytes, and have it more appropriate for my surgery. So I also know that I've got a lot of growth factors in this particular PRP. So again, there's a lot to it. I just read a study today that even the anticoagulant that you use, where we use sodium citrate in our M-site PRP kits, even the anticoagulant matters. I put bicarb with my PRP, and the reason I do that is because it allows for a better degranulation of the platelets, so I spill more growth factors into my treatment area. So again, not to really bore you with the details or even overwhelm you, because this is simple. You draw some blood, you spin it in the first cylinder, you transfer your platelet suspension to the second cylinder, you spin it again, you make your PRP. So I don't want you to feel like this is really complicated, because it isn't. But the way you get to the system that you use is somewhat complicated. I'm really making it easy for you here by showing you what system to use, but I want to also tell you why it is I'm using that system. And if you don't know why it is you're using the system that you're using, then I really encourage you to dive into the basic science. Give me a call. I'm happy to talk to you about this. In fact, if anyone wants information, I put sort of a buyer's guide together that talks about all of these. It's really short, but just the finer points of what it is that we're doing and why it is that I've decided on the type of plasma that I do spin in my practice. So again, lots of reasons to use this system, not the least of which is just a more natural pH, much more comfortable. So why offer these procedures in your practice? I mean, they're easy to spin PRP. Patients love it. It makes lots of sense. They are looking for platelet-rich plasma online. Believe me, if you look at those search terms, PRP, platelet-rich plasma, regenerative medicine, stem cell, you're going to see that they're really robust search terms. So people are looking at this. We have treated thousands of patients. There are literally no side effects at all. In fact, I've never heard of a complication, a long-term complication of platelet-rich plasma. You can very easily develop a reputation as a specialist using platelet-rich plasma in your marketplace, especially if you connect with me, my group, which is Studio PRP. If you go to studioprp.com, you'll see a beautiful consumer website where we want to try to appropriately present these different procedures to the consumer. We want to be honest with them. We want to set the right expectation. And you'll see some of the PRP providers listed there as well. There are also financial reasons. I mean, the name of this presentation is regenerating your practice revenue. And let's face it, that's why we're all part of FPC. I have a very robust, very profitable practice. I'm part of FPC because I want to be even more profitable. I want to be scalable. And so they are offering me some of that expertise. I already practice functional medicine, but there's always ways and little tricks and tips that hopefully, I'm new to FPC, so hopefully we'll share those as we get to know each other. I'm sharing this with you because it's really, it's pretty awesome. I put together some return on investment type projections. Another good selling point here, if you will, to you, the providers or practice owners, is this is such a no-brainer. We're talking the equipment price. I buy $100,000 lasers and different equipment that a $95,000 Thermiva to do vaginal rejuvenation. We're talking $5,500 for the M-site executive centrifuge and 10 kits. So that means you get to do 10 patients. All right, $5,500. Piece of cake. Really simple. So when we do, when I do play the rich plasma for sexual wellness for women and urinary incontinence, by the way, if you have a woman who has urge incontinence, this PRP is like magic. And I don't say that word very, very often. PRP is like magic when it comes to urinary incontinence, urge incontinence in particular. And so when I do that procedure, my total cost of goods, the platelet-rich plasma kit plus this Apex M, which is a medical device, and again, it's a couple of $100. So the PRP kit is $250. I throw in the Apex M because I want the best result, because that's what grows my business, and that's how I take the best care of my patient. So even at that cost of $449, I'm charging the patient $1,650. My gross profit is $1,200. My phlebotomist, or my MA rather, is drawing the patient's blood, or I'm drawing the patient's blood if I'm here by myself. We're taking 10 minutes to spin the platelet-rich plasma, and it's about 3 minutes for the injection. And then she's out the door and she's thrilled. I'm following up in 4 weeks and she's telling me how much better she's doing. So, I mean, $1,200, she's in that room for no more than a half an hour. And if you're a beginner, maybe it's 45 minutes. When's the last time you made $1,200 in 45 minutes? You know, this is amazing for your practice, and it's amazing for your patient. And the equipment entry is so low. It's really the perfect storm. And thank you, FPC, for allowing me to present this to you guys. And I'm really hoping that you guys will present these types of opportunities to me too. We're on the same playing field here. This just happens to be my niche. When we look at male sexual wellness, 50% of men and women actually go to their doctor complaining about sexual changes, and they want help. 50%. And the other 50% is concerned about, they're either seeing sexual changes and they're not going to their doctor, or, you know, they're concerned about the changes. And so it's a very, very big market. So with men, I include a very nice high-grade vacuum erection device with the platelet-rich plasma. So my cost is $450. Again, I'm not in there for any more than a half an hour, 45 minutes as a beginner. Very simple procedure. And my gross profit is $1,545. It's excellent. My Studio Scalp, which is my hair regrowth, again, I'm using just a platelet-rich plasma kit. I'm injecting it. I'm using a microneedler as well, which, you know, I'm happy to teach you guys how to do this. But my profit is unbelievable. There's lots of adjunctive supplements and also some compounds that you can sell along with this. And again, I'm happy to teach you how to do that. But just looking at the platelet-rich plasma piece of this is pretty awesome. I love the microneedling with PRP. My cost of goods, if I'm using, you know, the actual sleeve and the needler and the PRP kit, is $314. And my gross profit is almost $600. What I love about this is I don't do this procedure. I have my MAs do this procedure. And so, you know, we're generating this kind of revenue with a $15 to $25 an hour employee. And I love it. I love it because my MAs love to do this. Who doesn't like to do procedures, really? We all like to do procedures. So I'm getting them involved in that patient care. I'm also getting them involved in generating revenue. And this is a 30-minute procedure. So I have MAs doing these procedures and generating $900 per 30 minutes, and my gross profit is $585. All right, so I don't want to really belabor this. You get the point. If your practice is doing 5 procedures, I just took the average cost of goods and the average gross profit, and even this microneedling drags it down quite a bit. But the average gross profit, if you're doing 5 procedures a week, you're putting in you're adding to your bottom line $6,500. And if you do this every week of the year, or 240 procedures annually, and believe me, most of us are doing more than that, then you're adding $315,000 to your bottom line for a $5,500 investment. By the time you use these 10 kits, all right, even if you just did 10 of these microneedling facials, you've already recovered your cost of investment. All right, so there's no doubt that this is a highly profitable procedure. And I don't do anything that isn't effective here. Okay, so if I am ever talking to you about a technology that I use, I don't do anything that isn't effective. My patient comes first. The efficacy comes first. I don't mind taking the patient's money at all. I really don't, but it's important to me that I deliver an excellent value. And so I know we don't know each other, but I won't talk about, even to my patients, I won't do anything until it's proven its value to me. So these are things that I've done thousands of these procedures. So a lot of experience. Let me tell you how to get trained. There aren't a whole lot of good training options out there. There are, little half day if you can find them, but we do some very comprehensive training. I've trained doctors every single month for 6 years, so we've trained hundreds of physicians to do this. I am very blessed. I have 3 other professionals who have joined us in this training. Dr. Bano, who I mentioned earlier, is a urologist, been practicing for over 40 years. Dr. Aguirre is a urogynecologist, practicing for a long time. My very good friend, Dr. Rapol, is a urologist. She does an amazing job with these trainings. In fact, she teaches all of the procedures. Dr. Bano focuses on the sexual wellness. Dr. Geary teaches most of the procedures. So these are very well-respected physicians. There are group training opportunities, 1-day, 2-day group trainings. You can visit the Studio PRP website and learn about where those are. Dr. Rapol and I are doing a large training together next weekend, actually, at her clinic in Colorado. We've got lots of doctors signed up, so that should be a lot of fun. And then I'm available to do private trainings. And so with our FPC group, I want to let you know that we're very flexible with how we can do these trainings. I've been doing private trainings all over the place, in and outside of this country. I think private trainings are the best because I roll in, you have all of your equipment in place, you have all of your devices, all of the different medical supplies that you need in place. I come in and we start treating your patients. So you're actually going to do the procedures. Your staff is going to participate, so they're going to learn how to support you. I sometimes bring a colleague with me, and often I'll bring Heidi with me. Sometimes I bring Jill with me, and they train your front how to talk about these things. So a private training is really impactful because when I leave, you've treated patients. Everybody knows what to do. All your forms are in place. Your pricing is in place. And what's fun is you get to then follow up those patients. So you get to see what's happening. And that's when there's real buy-in. I mean, I know that you need to prove this to yourself, and I really respect that. So private training is a great way to do it. What I'm thinking with FPC is, I can go to San Antonio or some of my team, Dr. Aguirre, Dr. Rapol, Dr. Bano, we can go to San Antonio either pre-quarterly or post-quarterly. Maybe we rent some space, or we use one of the local FPC practices to do a small group training before or after the quarterly. I'm certainly open to something like that. Or I'm even thinking with over 200 practices across the country, maybe we do some regional training. So maybe, we go up to Boston and some FPC practice hosts the training and we invite other people from that region to the training. You generate revenue if you're hosting. There's lots of ways that we can do it. So I'm really interested in those creative ideas. Again, if you're interested in bringing this to your practice. We will train DOs, MDs, nurse practitioners, PAs. That's what I train here in Florida because that's who is allowed to inject in Florida. If chiropractors or naturopaths or technicians of some sort are able to inject in your state, then certainly they're welcome to attend the training, and we're happy to train them to do the procedures. I guess this slide is really just whoever's appropriate to actually inject and whoever's licensed to inject. we're happy to bring on board. And then staff members. So when we do a group training, for instance, when we're at Dr. Rapol's office next weekend and we're doing a group training, each one of the physicians that have signed up for training is welcome to bring a couple of non-injecting staff members. And that way, you know, your MA, your assistant, your technician, your office manager, your marketing person, whoever you want to bring gets to see all of this in action and gets to survey the patient. So when I do trainings at my place in Florida, when Dr. Rapol does trainings at her place in Colorado, these are our patients, and they either have already had a previous experience with PRP or it's their new experience. And so it's real life. You know, we call my practice the test kitchen. And that's really what we do. I have made a commitment to all of the doctors that I train, and certainly the physicians that join us, the providers that join us in Studio PRP, to share. You know, we're collaborating. Dr. Bano, Dr. Rapol, Dr. Aguirre have taught me so much. We tweak and we change the protocols based upon best practices. I think that's the best way to practice medicine for sure. So medicine is changing. Patients, as we know, are seeking wellness and prevention. Platelet-rich plasma goes right along with that. And I'll tell you, I have a fair amount of patients that come in. They don't even have problems, but they want to be proactive in preventing the problems. I have patients that play lots of tennis and lots of golf here in Florida. I'm not an orthopedic surgeon, but I feel very comfortable injecting large joints. And so I'm doing knees and shoulders for people who don't have significant problems, but they're looking for prevention. There's plenty of people that have problems. I just want you to expand your thinking here. Certainly aesthetics and some of these light aesthetics, are this PRP is sought after, but the sexual medicine, the urinary incontinence, you know, we're living in a time now where we actually see adult diaper, and these adults, they look my age. And that's the thing. You know, when we're in our 50s, we have women in particular with urinary incontinence. 43% of women of all ages, certainly as you get to be in your 40s and 50s, have urinary incontinence that is problematic, actually interferes with daily life activities. And so certainly sexual function and joint pain, we've talked a lot about them. Hair loss is a very big one that drives patients to my functional medicine practice. And so as a functional physician, I am able to help them with hair loss and regrowing hair. A lot of times it's nutritional, it's digestive, it's adrenal related. And then I'm able to stimulate that hair growth with platelet-rich plasma. So it's pretty cool. They help you grow your PRP practice. I haven't seen any questions come through. If you have any questions, please feel free to type them in. And you can reach me at info@studioprp.com. I will get that message if you send a clinical message directly to me. You can call the number on the screen. You can go to joinstudioprp.com to learn more about training options and prices. But let's get creative with how we train the FPC family. And if you want to email me directly, my address is Dr. Roy, DRROY, at doctorsstudio.com, all spelled out. I actually put my cell phone number here as I was communicating with Mary. You're welcome to call me. Might take me a bit to get back to you, but it's 813-230-4114. Shoot me a text, and I'm happy to help you in any way possible. So if you go to the let's see. Pretty sure it's on the joinstudioprp.com. There's a webinar tab. In fact, why don't I just pull it up here? There's a webinar tab that where you can see some of the basic science. The studioprp.com. Actually, I don't think you can see my screen. I'm going to try to get fancy here and change that. Have you see my entire screen? All right, there we go. I think you can see my screen now. So this is the consumer site. And, you know, I hate to toot my own horn, really. I didn't put this site together, but I think it's very nicely done and very professionally done. You know, sometimes when you're talking about sexual medicine People get a little bit weird, but it's very, very well done. You're welcome to take a look at it. If you look at the provider button here and become a provider, it takes you over to, it did take you over to joinstudioprp.com. And that's where you'll find, I think it's my internet connection. Here it's going. That's where you'll find the training site. A little talk about the procedures, the equipment that we use that I just ran through quickly, the different training options, and also the study and the webinar. The webinars, sorry that we've got a slow connection here. This PRP 101 is really high yield webinar, and that will teach you what I've been just touching on about the basic science. And this goes over some of the different training options, but I think you get the point. Okay. So if you're interested in the slides, let me know, send me a question or send me your email me, and I'm happy to go through that. Actually, I see the question here, but I can't seem to get to it. See if that helps. Something technology versus, here, let's see if, here we go. Seth, what's your elevator pitch to patients to differentiate between your methods and technology versus others using different methods or technology? Okay, great question, Seth. Thank you. So with female sexual wellness, let's just start there. That's really kind of my passion. There's just nothing for women. That's the thing. They're looking because there's nothing for women. So I don't even have to compare what I have to anything else. There's a new medication that was FDA approved last year. I'm sorry, the name escapes me. It's not very good. It's really not. And, we have bioidentical hormones, which I think a lot of us do bioidentical hormones, and we know how effective that can be. But it's difficult to improve sensitivity, intensity of orgasm. A woman who has pain with intercourse, there's nothing for her. I get lots of young women with pain, and it's not associated with hormones. They've been worked up by their GYN. There's no pathology that can be found. I can solve pain with intercourse, dyspareunia, with one PRP injection. And I got to tell you, it doesn't come back in a young woman. It's like it's a facilitated segment. It's this nerve, the nervous system is just jacked up, and we calm it right down with PRP. If it's hormone related, then certainly with hormone replacement, we can improve vaginal lubrication. But a lot of times still there's a change in sensitivity. There's a change in that tissue. PRP stimulates the Skene's glands to start lubricating. It creates a neuroangiogenesis, so you get more blood flow, you get more sensitivity. It's really pretty cool. When you talk about hair regrowth, you tell me, what's going to stimulate your hair to grow? What's going to stimulate that stem cell for your hair to grow? There's nothing. There's nothing. PRP works incredibly well. You've got some amniotic product out there. Most of it, I'll tell you, is garbage. The Bio-D, the A-cell, there's stuff out there that they can't even tell you what's in it. So if you're talking about comparing that technology, again, that's kind of a no-brainer too. There really isn't much to stimulate hair. If you're looking at cortisone injection versus PRP, there are some really good studies that show that the cortisone is, well, we know cortisone is degenerative, right? So you can only get it so many times. Well, PRP is regenerative. And we actually have some studies that show that pain control is much better with PRP than it is cortisone. I think on the Join site, there's some articles. If not, again, if you go through some training with me, I give you a really nice manual and lots of articles to refer to. Talking to patients about PRP is easy. It's easy. It makes perfect sense to them. They want a solution where you take their healing potential or their regenerative potential and you focus it and you put it where you want it. They know that these are exciting times. And so it's really easy. And I don't use any of the tools that I have in isolation. Someone says, well, did you build the house with the hammer or the screwdriver? Well, I mean, I needed them both. And you're going to need all of the tools that you have. You're going to need hormones. You're going to need lifestyle changes. You're going to need supplements. You're going to need, you know, microneedling device. You're going to need these lasers. You're going to need these other tools. So I use platelet-rich plasma as a tool in conjunction with lots of things. I hope that answered your question. But when I talk to patients about how exciting it is to concentrate their healing potential, their regenerative potential, and focus it, they just say, when can we do it? I'm serious. It's really that easy. Now, Deborah asked me, at your practice in Florida, how much is your training? Oops, sorry, you just said it. Sorry. Yeah, you can find out more information about training on the joinstudioprp.com. And again, let's get creative. Let's get creative. Be a host site. Be a host site and invite other doctors to come and learn PRP at your place. And that would make it a win-win for everybody. Or do a private training. I'll tell you, I've never done a private training, to my knowledge. I should qualify that. I've never done a private training where the practice didn't fully recover not only their cost of the equipment, but also my fees in the actual training, because they're charging their patients. They're attracting patients. They're giving a discount. Typically, we give about a 30% discount for these procedures. We do email blasts. We really publicize the fact that, the expert is coming to town, and you guys are excited about this. And everybody really recovers their cost. They never have to leave their home. Their staff is trained. So costs can be really handled in lots of different ways. But these are very profitable and effective treatments. All right, so I don't want to belabor all this. I really appreciate your time. I know it's hard to do these things on a Monday night.